Mattress sets with 5 years no interest. Mermaid Mattress, your home for better sleep.
Wake up with Channel 3 Eyewitness News today. Coverage you can count on.
Here we are in the month of February. Very often on 3+U over the years, we've focused on heart health when it comes to adults. But this morning, we're going to switch gears a little bit and focus on the pediatric patients out there, because as many parents are quite aware, there can be heart conditions that can surface as your child ages. So it's quite a pleasure to bring in Dr. Jeb Raulston. He is fairly new to Chattanooga. He's a pediatric cardiologist at the Children's Hospital at Erlanger. Good morning to you.
Good morning.
So you were sharing with me that many people might think that a congenital heart defect would show up at birth, but the truth is this often hits parents unprepared when their kids are 8 and 10 years old.
That's right. So congenital heart defects in general are actually the most common forms of birth defects. About 1 in 100 babies will be born with some form of congenital heart disease. And that comes out to about 40,000 babies per year. And to put that in even a larger perspective, there's about 2.4 million people in the country living with congenital heart disease. And most of the more severe forms of heart defects do get picked up prenatally or before babies leave the hospital after birth. But we see plenty of kids showing up with mild forms of congenital heart defects and even more severe forms later in life.
So give us a bit of an education. We'll go to medical school in 5 or 6 minutes here. But what are the warning signs that parents would watch for?
Sure. So, again, most of the more severe symptoms are going to be obvious after birth. And in babies, it's usually tied to poor growth or difficulty with feeds, breathing hard and fast for long periods of time. Most of those things are picked up easily by pediatricians who are seeing babies frequently in the first year of life. In older kids, we start to see more chest pain, palpitations, some difficulty breathing, and even more severe symptoms like passing out episodes. And as pediatric cardiologists, we're really most worried in that age group about symptoms that are present during exercise. So we definitely need to know about that. Thankfully, most of these symptoms can be evaluated or looked into by patients' pediatricians. Our team's always available for additional testing, additional evaluation, and recommendations.
So, sports obviously has been so different this year for kids because of COVID, but some are still in effect. We're waiting to find out about soccer in the spring and that kind of thing. In case the kids are out on the field or the court and they get winded, let's say, and it's a little bit unusual for them to feel out of breath, is that an indicator where parents should go ahead and get their child in to see their pediatrician?
I would have the pediatrician take a look, and if there's any concerns about the way that the heart sounds on exam or anything else in the office that's concerning about the story, we frequently will see those patients to make sure that there's not an underlying structural heart problem. There are some heart conditions that can be acquired later in life, but we still diagnose a good amount of congenital heart disease that presents with sports-related symptoms in the teenage years.
I don't really know how to phrase my question, so forgive me if I stumble with it here. But if heart disease runs in your family, if you had a grandfather who died of a heart attack, does that make your child more likely to develop a congenital heart defect, or are they two separate things?
They are two separate things. So, like I said, the overall incidence of congenital heart disease is 1% in the general population. If there's a first-degree relative, a sibling or parent who had a congenital heart defect, there's about a 5% chance that their child might. But in terms of adult onset coronary artery disease or other forms of heart disease that affects mostly adults, there does not seem to be an association with heart defects in kids.
Okay, I mentioned the teenagers out there for a second, the kids playing sports. You are a pediatric cardiologist. Sometimes when you get to be 16, 17 years old, you think, oh, I don't need the pediatric side of life. In this case, is that still an important factor?
Yeah, we see patients, first of all, before they're even born for the more severe heart defects. all the way up through the adult years. And there is a subset of pediatric cardiology now called adult congenital heart disease, where, as opposed to 20 years ago when there may not have been a great intervention for some of these heart defects, now we're seeing patients live prosperous lives into their adult years. So we even see adults well into their 20s, 30s, and even 40s in our pediatric cardiology clinic for some of these congenital heart defects.
Okay, so you set me up. I have two last questions for you. The first is where you just were leading us, which is that if you get the diagnosis, there is very much a plan that you can put in place and no reason to completely panic.
That's right. So thankfully, most of these heart defects are what we call simple defects, things that people may refer to as holes in the heart that usually close up on their own. And for those, we really keep an eye on them. If they're diagnosed right after birth, we watch them frequently in the first year of life or so, and then start to space out the appointments, and there may not need to be any kind of medication or procedure to get rid of them. We certainly take care of babies who are born with very severe forms of heart disease, that some that even require open heart surgery in the first few days of life. Mm-hmm. And those babies obviously need very frequent follow-up in our clinic. So the good news is, yes, we have cutting-edge technology. We have new heart surgery procedures and other interventional procedures to correct some of these defects. But by and large, most of these are simple defects that won't need much intervention.
And then aren't you doing something in the days to come to honor your heart warriors, as you call them?
Yes. So, CHD week starts next week. The whole month of February is a Heart Awareness Month, and that's sponsored by the American Heart Association. Here at Erlanger and in our clinic, next week, each day has a different theme. We have a tie-dye day and a superhero day and a sports theme day, where the staff in the clinics and in the hospital are encouraged to dress up with the theme. We're also having each subspecialty clinic kind of decorate their area, and we're going to have one of our heart warrior patients hopefully be the judge to see who has the most spirit. And then we also partner with a local bakery to make some treats for the kids that are coming to clinic for appointments. So the whole purpose is to make families and patients feel comfortable and appreciated, and to increase awareness of congenital heart disease in our community.
Well, thank you so much for sharing some of your time with us this morning. Welcome to Chattanooga, and you did give us a pretty good education in the course of just a few minutes, and so we thank you for that.
Thank you. Thank you for having me.
You can find Dr. Jeb Raulston, again, at Children's Hospital at Erlanger. Their phone number, easy enough to remember, is 778-KIDS. That's 778-5437. The website, childrens@erlanger.org. We're back after this.
James, your car was pulling to the right, and you came to Budget Brake seeking alignment. What happened?
They fixed it for the best price in town.
His path was crooked